All right, good morning, everyone. My name is Morakinyo Ayo Ogunbayode. I am presenting a topic, complications of diabetes mellitus type 2 in St. Kitts Island. And this is a federation in the Caribbean, West Indies. So I will just be giving an overview of the complications of diabetes type 2. The summary to this topic: diabetes mellitus type 2 is a chronic disease, and it is the leading cause of, it is the most common form of diabetes, accounting for at least 90% of all cases, and it's a chronic disease that causes illness, disability, and death in the patient that have it. According to the American Diabetes Association, the condition is defined as higher than relative insulin deficiency. Diagnosis of the condition diabetes type 2 can occur at any age. However, it usually remains undetected for years until the complication appears. Diabetic complication is due to uncontrolled diabetes, which is identified through metabolic markers such as elevated blood glucose, blood lipids, cholesterol level, and urinary albumin. The complications of diabetes type 2 can be separated into macrovascular and microvascular. The macrovascular complication includes the cardiovascular complication, cerebrovascular complication, and the peripheral arterial disease, while the microvascular complication includes the diabetic nephropathy, diabetic neuropathy, and diabetic retinopathy. The complications reduce the quality of lives of patients, and this incur heavy burdens to the healthcare system, and it increased diabetic mortality in patients. In St. Kitts Island, where I reside, the leading cause of death in men is diabetic complication type 2 complication, and is the second cause of death in women. There's a study that was done and is being published by the Pan American Health Organization, and it's being carried out between 2006 and 2010. There were 1,811 deaths. In that period, the disease of the circulatory system, malignant neoplasm, accounted for 35% and 17% of deaths, respectively. 12% of deaths among adults in that period were caused by external injuries, and 11% were due to diabetic complication. You can see the Pan American Health Organization for reference in 2013. And the study of this presentation is being focused on the St. Kitts Island. The problems relating to diabetic complication. As I said earlier, the complications are divided into microvascular and macrovascular. The microvascular is defined as the damage to the small blood vessels in the patient that have it, and the macrovascular is due to damage to larger blood vessels. And the microvascular complication include damage to the eyes, which causes a condition called retinopathy, leading to blindness, and damage to the kidneys, which causes a condition called nephropathy, leading to renal failure, and to the nerves, neuropathy condition, leading to impotence and diabetic foot disorders, which include severe infection leading to amputation. There is a schematic diagram showing how the complication of diabetes type 2 arise. We can see the one for the cardiovascular complication. It starts from the person being normal, and the person might develop a condition, coronary heart disease, leading to either angina condition, or the person might have a history of myocardial infarction, and all these problems will create more problems, eventually leading to death in the patient. And we could see other conditions: stroke, nephropathy, neuropathy, and the retinopathy aspect of the complication of the diabetic type 2. And there's another diagram showing the differences, the macrovascular and the macrovascular complication. We can see the stroke occurs in the cerebrovascular region, and the macrovascular says complication is diabetic eye disease causing the retinopathy and the cataract, and the condition that affect the heart, the heart disease and the hypertension, the one for the kidney causing renal disease, which eventually will lead to the end-stage renal disease and might cause death if not treated. And we have the peripheral vascular disease condition and the foot condition, which can lead to lower extremity amputation in severe condition. The method that was used in this study, it's a study that was conducted to evaluate the complication of patients with type 2. They were admitted to the internal medicine department at the Joseph Nathaniel France General Hospital in St. Kitts, and the data that was used, they were extracted from 240 case reports with a comprehensive medical history and physical examination of each patient. And the result that was gotten, or the result that we interpreted from the research or the project, is it reveals that at least patients that came to the hospital for care due to diabetic complication have diabetic complication of cardiovascular, cerebrovascular, peripheral arterial disease, and they also have nephropathy, neuropathy, and retinopathy. Out of the entire sample size with complication, we have 70% of patients having the macrovascular complication and 30% of them having the microvascular complication. The chronic complications are categorized as cardiovascular conditions. We have the cerebrovascular condition, the nephropathy, ocular lesions, the neuropathy, and the diabetic foot problems. This developed after proper diagnosis of diabetes type 2 were considered in this study, and the cardiovascular morbidity included were hypertension, angina, chronic heart failure, myocardial infarction, and other related heart disease, and peripheral vascular disease. The considered cerebrovascular conditions were stroke and transient ischemic attack. We have the ocular lesions, which consist of the retinopathy, the cataract, and further leading to blindness. The nephropathic condition complication includes the macroalbuminuria, the renal hypofunction, and renal failure. And we also have the diabetic foot problems, which presented as foot ulcers and amputation in the patient. These are my references if you want to find out more about diabetic complication. And the conclusion, in the Federation of St. Kitts, complication of diabetes type 2 impose a substantial economic burden on healthcare systems. Health complication associated with type 2 in St. Kitts can be prevented, delayed, or reduced if The condition is diagnosed early and is well controlled. According to Dr. Michael I.J. Fowler, the importance of protecting the body from hyperglycemia cannot be overstated. The direct and indirect effect on the human vascular tree are the major source of morbidity and mortality in type 2 diabetes. Therefore, maintaining blood glucose level, blood pressure, and cholesterol at or close to normal can help delay or prevent diabetes complication. This can be accomplished through regular diabetic monitoring. Thank you for listening.
Hello. Thank you.